Hi, my name is Matthew Orap, and on behalf of our QI team at Baylor Scott White Round Rock, I'm here to present our Improving Timely Admission MedRec to enhance patient safety and hospital throughput, our QI project. We do not have any financial disclosures to report. For background, Timely Admission MedRec reduces medication discrepancies and helps ensure that necessary home meds are resumed while potentially harmful or duplicate therapies are discontinued. It is found that approximately only 40% of MedRecs were completed within 24 to 48 hours of admission in November 2025 at Baylor Scott White Round Rock. This is problematic because delayed reconciliation shifted work towards discharge, potentially contributing to medication clarification and discharge delays. Our goal was to increase admission MedRec completion within 24 to 48 hours to greater than or equal to 80% by April 2026. So we began with a pre-intervention review of 40 patients admitted between November 15th to 18th. Patients were included if they remained hospitalized for at least one day and were admitted to a med-surg IMC or intensive care unit. We used process mapping and root cause analysis to examine the existing workflow. The barriers we identified included inconsistent ownership of MedRecs, limited workflow prompts, provider turnover, unavailable or incomplete med histories, and deferral of reconciliation following overnight admissions. Our intervention included three main components. On January 9th, 2026, we provided resident education and reinforced the use of the Admission MedRec Complete column in the EMR, which is EPIC. This provided a shared visible metric that allowed clinicians to identify whether MedRec has been completed. Second, on February 19th, our QI team met with the hospitalist team to review the existing MedRec process. We disclosed barriers to timely completion and reinforced the expectation that reconciliation should be completed within 24 to 48 hours. We also created an educational workflow flyer and placed it in the hospitalist work area as our third intervention. Following these interventions, we reviewed another set of 40 patients admitted between March 19th to 25th of 2026. And from our findings here, we found that our overall completion increased from 37% to 62.5%, which is an absolute improvement of 25.5 percentage points. Among residents managed medical, surgical, and intermediate care admissions, daytime completion increased from 6% to 36%, while daytime non-completion decreased from 29% to 5%. Among non-resident providers, daytime completion increased from 12 to 44%. And so when daytime admissions were evaluated separately, completion approached 80 to 89%. These findings suggest that our target may be attainable when the workflow is applied consistently. However, overnight admissions remain the largest opportunity for improvement, as well as our ICU results, which is limited by small post-interventional sample, which is limited by the patient state on admission, preventing an appropriate MedRec to be done. Overall, our intervention improved timely admission, timely admission of MedRec. However, we failed to achieve our overall goal of attaining at least 80% completion. Daytime performance was encouraging, but improved visibility did not fully resolve unclear ownership. For next steps, we would like to consider adding an overnight admission checklist item, reviewing incomplete reconciliations during multidisciplinary rounds and on shift handoffs, and possibly partnering with pharmacy for high-risk medications. Thank you for reviewing our project.